there's only 2 dissected out so far. I'm working on the 3rd one, so you can grab one after I've taken this one around and shown everybody. Especially look at that one that's still covered with fat, so you can see the parietal and visceral pericardium. Okay, first thing we want to figure out is, are we looking at the anterior or the posterior surface, and how do we know? And the way to tell is look for the little auricles, and if they're sort of facing you, that's the anterior surface. You can still see them from the posterior, but here's where they're really facing you. So, anterior surface, and we have our, we need to get rid of a lot of fat to see this, but there's an interventricular sulcus telling me right and left ventricles, so left and right I should say, and it's got an interventricular artery and vein running through it. You can just open it up to verify what you got there. So left ventricle, much heavier muscle than the right ventricle. So left and right ventricles. Here's the chordae tendineae, and they are anchored to the valves. So on the left side it's going to be anchored to the bicuspid, on the right side it's going to be anchored to the tricuspid valve, and there's the valve right there. Right in there, that's remnants of the valve. On the other end they are anchored to papillary muscles. See the little papillary, like finger-shaped muscles, or maybe sausage-shaped muscles. Those are the papillary muscles. When they contract, they're going to pull those cords tight to hold the valve so the blood can't go the wrong way. Lining the ventricles is the carnae trabeculae, which if you spread it open you can see it. So there's your carnae trabeculae, kind of lacy looking muscle there. That's the carnae trabeculae inside of the atria, and you can use your probe to go through the valves to ensure that you are in the atria.
Are we going to get one of those?
There's only a couple of them in dissect, so there's about 3 to look at so far. You can use your probe and go up in there. In lining that will be the pectinate muscle. You can see that on the model a little better. What we want to do is identify each of these blood vessels. And you could probably give it a pretty good guess just by looking. But use your finger or a probe and go through to which chamber you end up in, and that'll tell you what it is. So the aorta is going to go to which chamber?
Left ventricle.
Yeah. And your pulmonary trunk?
Right ventricle.
Yeah. And then there's also going to be the superior and inferior vena cava on here, and those of course are going to go to the right atrium. So once you get one, just use your probes and try to identify where it's going to. And I'll try to get some more